Clinical psychology relies heavily on measurement to understand, assess, and treat various mental health conditions. In this video, we will explore the significance of measurement in clinical psychology, the types of measurements used, standardized tests, psychometric properties, challenges, advances, and future directions in measurement techniques. Introduction to measurement in clinical psychology. Measurement in clinical psychology involves the systematic collection, analysis, and interpretation of data related to psychological phenomena. It allows psychologists to quantify psychological constructs and behaviors, aiding in diagnosis, treatment planning, and outcome evaluation. Importance of measurement in clinical psychology. Accurate measurement is crucial for understanding the complexities of human behavior and mental processes. It provides clinicians with objective data to inform their assessments and interventions, leading to more effective treatment outcomes. Additionally, measurement facilitates communication and collaborating among professionals in the field. Types of measurements used in clinical psychology. Quantitative measurements. Quantitative measurements involve numerical data and statistical analysis. They include measures of symptom severity, cognitive functioning, and treatment progress, among others. Examples include rating scales, questionnaires, and performance-based assessments. Qualitative measurements. Qualitative measurements capture the richness and depth of individuals' experiences through narrative descriptions. They are particularly useful for exploring subjective phenomena such as emotions, beliefs, and interpersonal dynamics. Techniques such as interviews, case studies, and content analysis fall under this category. Standardized tests in clinical psychology. Standardized tests provide reliable and valid measures of specific psychological constructs. They have undergone rigorous development and validation processes to ensure their accuracy and consistency across different populations. Common types of standardized tests in clinical psychology include intelligence tests. Intelligence tests assess cognitive abilities such as reasoning, problem solving, and memory. They help clinicians identify intellectual strengths and weaknesses and inform educational and vocational planning. Personality assessments. Personality assessments evaluate individuals' characteristics, patterns of thoughts, feelings, and behaviors. They provide insights into personality traits, psychopathology, and interpersonal functioning, guiding treatment approaches and interventions. Behavioral observations. Behavioral observations involve systematic monitoring and recording of observable behaviors in naturalistic or controlled settings. They provide valuable information about clients' functioning, social interactions, and response to interventions. Psychometric properties are essential considerations when evaluating the quality of measurement tools. Key properties include reliability and standardization. Reliable measures yield consistent scores upon repeated administration, while valid measures accurately assess the intended construct of trait. Standardization involves the establishment of norms and procedures for administrating and scoring measurement tools, ensuring consistency and comparability of scores across individuals and settings. In clinical psychology, measurement faces challenges such as cultural and ethical considerations. Clinicians must consider cultural factors when selecting and interpreting measurement tools to ensure their relevance and accuracy across diverse populations. Ethical issues arise in the development, administration, and interpretation of measurement tools, requiring clinicians to uphold ethical standards regarding confidentiality, informed consent, and the use of assessment results. Advances in technology and research have led to innovations in measurement techniques in clinical psychology. Technology-enabled assessments offer new opportunities for data collection, monitoring, and intervention delivery, enhancing accessibility, efficiency, and precision in psychological assessment and treatment. Neuropsychological assessment techniques provide valuable information for diagnosis, treatment planning, and rehabilitation in individuals with neurological conditions or injuries. The future of measurement in clinical psychology is marked by continued innovation and integration of interdisciplinary approaches. Emerging trends include the utilization of big data, analytic and machine learning algorithms, integration of biomarkers and neuroimaging techniques into assessment protocols, and expansion of telepsychology services and remote monitoring tools to improve access to care and support continuity of treatments. Clinical interventions play a crucial role in addressing various mental health concerns and improving overall well-being. These interventions encompass a range of therapeutic techniques and approaches tailored to meet the unique needs of individuals. Understanding the key features of clinical interventions is essential for both practitioners and individuals seeking mental health support. One of the fundamental aspects of clinical interventions is their reliance on evidence-based practices. These practices are rooted in scientific research and have been demonstrated to be effective in treating specific mental health disorders. By utilizing evidence-based interventions, clinical psychologists can ensure that their clients receive the most appropriate and beneficial treatments. Another key feature of clinical interventions is their personalized and tailored approach to treatments. Each individual has unique experiences, challenges, and strengths, and clinical psychologists work to develop interventions that address these specific factors. By tailoring interventions to the individual, psychologists can maximize effectiveness and enhance outcomes. Successful clinical interventions are built on a foundation of collaboration between the psychologist and the client. This collaborative relationship fosters trust, open communication, and mutual respect, which are essential for effective treatments. Clients are active participants in their own care, working alongside the psychologist to identify goals, develop strategies, and track progress. Clinical interventions are inherently goal-oriented, focusing on specific objectives aimed at improving mental health and well-being. These goals are established collaboratively between the psychologist and the clients and serve as a roadmap for treatments. By setting clear and achievable goals, individuals can track their progress and stay motivated through the intervention process. Clinical psychologists play a central role in designing, implementing, and evaluating clinical interventions. They possess specialized training and expertise in assessing and treating a wide range of mental health concerns. In addition to providing direct therapeutic services, clinical psychologists also engage in research, consultation, and advocacy to advance the field of mental health. Despite their effectiveness, clinical interventions are not without challenges. Factors such as limited access to care, stigma surrounding mental illness, and resource constraints can hinder the implementation of interventions. Addressing these challenges requires a multifaceted approach involving policymakers, healthcare providers, and community stakeholders. Ethical considerations are paramount in the practice of clinical psychology and the delivery of interventions. Psychologists adhere to strict ethical guidelines and principles to ensure the welfare and autonomy of their clients. This includes obtaining informed consent, maintaining confidentiality, and avoiding conflicts of interest. The field of clinical psychology is continually evolving with ongoing advancements in research, technology, and treatment modalities. Future directions in clinical interventions may include greater integration of technology, increasing emphasis on prevention and early intervention, and a focus on culturally sensitive and inclusive practices. Measurement plays a central role in clinical psychology, providing clinicians with valuable insights into individuals' psychological functioning and guiding evidence-based practice. By understanding the types of measurements used, standardized tests, psychometric properties, challenges, advances, and future directions in measurement techniques, clinicians can enhance the quality and effectiveness of their assessment and interventions efforts. Clinical interventions are a cornerstone of mental health treatments, offering individuals support, guidance, and hope for recovery. By understanding the key features of clinical interventions and the role of the clinical psychologist, individuals can make informed decisions about their mental health care and work towards achieving their goals. Clinical psychologists are mental health professionals dedicated to helping people manage emotional distress, mental disorders, and life challenges. Psychotherapy, the act of providing psychological treatment, is a central part of their work. Ethical practice forms the foundation of trust and safety in the therapeutic relationship. Clients have the right to make their own choices about their lives and treatments. Therapists strive to do what's in their clients' best interest and have the responsibility to avoid actions that could cause harm. Clients deserve access to fair treatment regardless of background or identity, and therapists build a relationship based on trust, honesty, and reliability. Client information is held in the strictest confidence. Even with the best intentions, clinical psychologists face complex situations where clear-cut answers aren't always available. Common ethical challenges include dual relationships, maintaining clear links between the therapist's professional and personal life, working with their skill set, ensuring informed consent, and branching confidentiality if there is a threat of harm to clients or others. Therapists must consider the meaning behind gifts from clients and potential effects on the therapeutic relationship. Ideally, ending therapy is mutual and planned, but there are times when a therapist may need to terminate. Therapists must ensure privacy and security when using technology, and sharing personal information must be done judiciously and only when it could benefit the clients. Navigating ethical dilemmas isn't easy. Therapists can turn to ethical codes provided by professional organizations, discuss complicated scenarios with trusted colleagues, and work with a supervisor to aid in developing strong ethical decision-making skills. When therapists violate ethical principles, the consequences can be severe, including harm to clients, damage to the therapist's reputation, and potential legal ramifications. Staying vigilant about ethics is an ongoing process. Continuous reflection, education, and a willingness to seek guidance are essential to providing clients with the safe, effective care they deserve.